Well, we may have exited the third wave of the Covid-19 pandemic, but what of a fourth wave? The great fear, of course, is that it will hit in the festive season. We're joined now by Professor Bruce Malado of the Gauteng Coronavirus Command Council. He's a mathematical modeler and has predicted the previous waves in Gauteng. Professor, good evening. Thank you for your time on the Pulse tonight. Can we say with an utter certainty that there will definitely be a fourth wave of Covid-19?
Thanks for having me, Stephen. Unfortunately, a fourth wave is going to happen. I mean, the mathematics of it is very clear. I mean, we can, of course, always debate as to how big it will be and the characteristics of a fourth wave, given the uncertainties we have when we model. But it's clear that a fourth wave is going to take place. And as on other occasions, it is super spread events that actually is going to trigger the fourth wave.
How important is a variance to a fourth wave? I mean, could a fourth wave happen even if there was no new variant, if just, the Delta and Beta variants that, not that we've become used to, but that we've been living with for some time now, are the only variants around? I mean, how important a factor is the issue of variance?
We look at the issue of variance of this mutations very, very carefully. We get reports from the experts on a regular basis. And also we get information as to how many people get reinfected, which is a very important parameter for any wave or any modeling whatsoever. So even if we assume that there will be no new variants, we still are going to see a fourth wave. Granted, it will not be as big as the third in the province, but yet it will be big enough in order to generate mortality and excess mortality, unfortunately, and hospitalizations, even if it is significantly smaller than the third. And again, that is assuming that there's no new mutations that will create a new kind of virus that will escape the existing treatments or existing vaccinations, of course.
Okay, so why, I'm going to scratch my head a little bit when I ask this question, why, even if there's no new variant, we will definitely have a fourth wave, why is the third wave ended? Why does the number of cases go down, and then all things being equal, nothing changes, does the graph go up again?
Well, you're asking a very good question. I mean, we have to look at the characteristics of how the waves behave. I mean, the waves have a certain cyclical character, and what happens is that you have an increase, a peak, and then a decrease where community transmission drops, that with which you gradually are transmitting the virus to the population. Now, it's very clear that based on the number of measurements and also the analytics of the data we have to date, is that the majority of the population in the province has had the virus and has some kind of protection that will diminish the probability of reinfection or acquiring the virus a second time. That being said, there is always a fraction of the population that is left. We haven't infected 100%. And when we deal with big numbers, the situation is that you have all the grounds for a fourth wave to come in. Now, you're asking a very good question in that, yes, the way the waves work is that they're going to be reaching a peak because there's a strong societal reaction that somehow prevents people from engaging in social distancing unnecessarily, or at least more so compared to when there's no peak. And then, of course, people retract because they are concerned about the exposure to the virus, and then the community transmission goes down before herd immunity has been achieved. That has happened with the first, the second, and the third waves. That's the way the waves have worked so far.
Okay. I presume, I mean, there's so many different factors that would affect how bad it would be. One of them would be if immunity changes. So we know that a vaccine gives immunity. We also know that if you've been infected by the virus, so if you've had, let's just keep it all with the Delta variant for now, if you've had the Delta variant, you have some immunity. What I suppose we don't know is how long that immunity lasts, and that takes us to the point you made earlier about the possibility of reinfection.
Correct, and there's always an uncertainty that we have. I mean, if you look at the literature and also the opinion of experts that understand the nitty-gritty of these viruses, there is no very good understanding that we can put into our models as to how long does the the protection last. So that's why monitoring the situation, in particular monitoring the level of reinfections, is so absolutely critical. And this is done on a regular basis by the NICD and other stakeholders in the country that are looking very carefully as to whether we have spikes or unexpected increases in the rate with which people get reinfected. So far, that rate is small. And for as long as it is stable, we can say that within the boundaries of the system we try to model, there is a certain level of protection. Now, we don't know what's going to happen a year from now. That's certainly not something that we know and we can predict for, but we can certainly, based on what we know right now, we can make predictions for what's going to happen in the months to come.
Is there, so up until now, when we think of a wave, we think of quite a large number of people dying, especially after the experience of the third wave and particularly the second wave. Would a fourth wave necessarily be that bad? I mean, could it be much smaller than the waves that we've seen before? And obviously vaccinations plays a key role here.
Right, so there's two very important factors that will make the fourth wave different in Gauteng compared to the third wave. First is that we expect the number of positives, the infections, to be 3 to 4 times smaller, which still is a large number. Let's not relax. That's not the message we want to put out there. And also the fact now that there is a significant fraction of the vulnerable population that is now getting vaccinated, and it is well understood now what kind of protection do vaccinated people get. So right now, if you look at the statistics, we have about 45% of people over 60 that are fully vaccinated, and we are approaching 60% of people over 60 that have had at least one vaccination. That is significant, although we are concerned that the rate as of a week or so of vaccination of people over 60 has declined significantly. We're also concerned about the relatively low level of vaccination of people between 50 and 59, and overall the low rate of vaccination that we are seeing now. So we are calling for people, especially, we're calling for everybody to get vaccinated, of course, but especially if you have comorbidities or you are of age, that you need to get vaccinated before the fourth wave comes in, because it's been proven mathematically that vaccination does have a serious impact in reducing the severe infection, hospitalization, and mortality.
I mean, obviously, then timing becomes really important. I mean, the last thing anyone wants, the last thing anyone wants is a fourth wave, but timing does matter. I mean, it can actually be quite important. If you look at the other waves that we've seen, is there likely to be a link between the gap between those waves and when a fourth wave would happen?
Well, we've seen, even if you look at the data, I mean, there's an element of periodicity that comes into play. There's, of course, we are tempted to say, well, every so many months we expect a wave to take place. But one has to look at the details of what triggered those waves. So if you, for instance, go back, basically almost a year ago when the second wave was triggered, we know by looking at the data that it was triggered by something concrete. And that was, at that time, a lot of end of year or end of scholar year celebrations, because we saw a spike in the number of people of a certain age bracket getting infected. And there were a lot of parties, a lot of movement among provinces. And that basically was the thing that triggered the second wave. And the same thing goes for all the waves. So there's always something that is going to trigger it. It's not something that is going to happen spontaneously. That has to happen because we've already are past the last peak by, say, 6 months or whatever that amount of time is. But there are events that are going to trigger it. And of course, if we're so lucky that the fourth wave will be delayed as late as the festive period itself is a source of concern.
Well, I mean, I suppose so, unfortunately, so is the election period. But let me put the question to you in this way. I would like to hope that we don't have a fourth wave having already started by election day, the 1st of November. Let's call it a month from now.
Indeed. I mean, our committee doesn't look at the politics of the subject. We always treat potential super spread events as a source of concern and a source of risk. We always have been very outspoken about that. Any event, regardless of the nature of that event, as long as it involves congregations of people, and the fact that some people don't respect social distancing or don't wear masks or don't sanitize or don't keep the physical distance, the more people we have, the likelihood of the super spreader event to basically trigger a wave is, of course, much greater. And we've always been open about it, and we've always expressed our concerns about what happens if we go to election day and don't adhere to social distancing.
Professor Bruce Malado, thanks very much indeed, from the Gauteng Coronavirus Command Council, but also a mathematical modeler predicting waves of the coronavirus. Professor, thank you.